Well, the Ebola patient in Texas also flew into the U.S. from West Africa via Brussels. And tonight, hospital officials say he is in critical condition. In the face of criticism of the way his case has been handled, authorities are now working to prove they are up to the challenge. Manuel Bojorquez reports from Dallas.
Doctors at Texas Health Presbyterian Hospital say Thomas Duncan is now critically ill. He's been in an isolation unit for 6 days. The news comes as officials here try to reassure the public after a series of missteps. Late yesterday, the 4 others who were quarantined in the apartment were escorted to a more secure location. Officials apologized for not moving them sooner. Dallas County Judge Clay Jenkins tried to calm fears.
I'm wearing the same shirt I was when I was in the car with that family. If there were any risk, I would not expose myself or my family to that risk.
It took 3 days after the diagnosis for officials to bring in a hazmat crew to decontaminate the apartment. And Duncan may have put more people at risk of infection for 2 days after his first symptoms, since he was initially released by the hospital. Officials there first blamed a flaw in communications within their electronic record system. Now they say there was no flaw, and the medical team had access to information that he had come from West Africa, but would not elaborate on why Duncan was released. Thomas Frieden is director of the Centers for Disease Control and Prevention.
The arrival of the first Ebola patient in the U.S. has really increased attention to what health workers need to do in this country to be alert.
Now a team of health workers are monitoring nearly 50 people in Dallas who may have had contact with the patient. Officials emphasize the virus is not spread through the air, but only by direct contact with the bodily fluids of an infected person. Michelle, they believe 9 people had close contact with Duncan, but say so far none has shown symptoms.
Manuel Bojorquez, thank you.